Bristi Majumdar? Yeah. So you'll be speaking on comparison of outcomes of single versus multiple surgeries in open globes injuries.
Good morning to all. I will be presenting my paper on comparison of outcomes in single versus multiple surgeries in cases of open globe injuries. Open globe injuries, or OGIs, are a cause of sudden vision loss, especially among the working age group. And the first treatment is always a primary repair to preserve globe integrity. However, further surgeries may be required for visual rehabilitation. And there is not much literature comparing the outcomes of single versus multiple surgeries in cases of OGIs. The aim of this study was to compare the functional outcomes of single versus multiple surgeries in open globe injuries. It was a retrospective observational study done from January 2018 to July 2024. 102 cases of OGIs undergoing single or multiple surgeries at our institute were included. Cases with less than 3 months of follow-up or undergoing any of the surgeries elsewhere were excluded. Demographic details, number and type of primary repair and additional surgeries, best corrected logMAR visual acuity at presentation, after first surgery, and at final visit were noted. Cases were divided into two groups with 51 cases in each. Group 1 for primary repair only, that is one surgery, and Group 2 for more than one surgery. Functional outcomes of both groups were compared. The mean age of this study was 24.06 years, mean duration of presentation 54.9 hours, mean initial logMAR best corrected visual acuity 2.81, and mean final visual acuity 1.75. The mean follow-up duration was 12.38 months, and there were more males in this study. The figure shows that the most common type of primary repair done was corneal tear repair. Comparing groups 1 and 2, we can see there was significant improvement in visual acuity in both groups, but there was greater improvement seen for the group 2, that is the multiple surgery group. However, the p-value comparing the final visual acuities of both groups in this study was not statistically significant. In group 1, the most common surgery done was primary repair only. Few cases included procedures like lens aspiration, vitrectomy, and intraocular foreign body removal. In group 2, majority of cases underwent 2 surgeries and 6 cases underwent 3 surgeries. The parameters noted were the best corrected visual acuity at presentation, after first surgery, and at final visit, and the p-value comparing the visual acuity between these groups was significant for all as seen. But the largest effect size was seen when comparing the initial versus the final visual acuity. In group 2, again, we divided the cases which involved procedures in the anterior segment only and procedures in the posterior segment. In the anterior segment, the most common surgery done was cataract surgery or lens aspiration with or without IOL implantation. And for posterior segment, it was retinal detachment surgery with or without lensectomy. For the 6 cases that underwent a third surgery, the second surgery involved various procedures like anterior chamber wash, vitreous lavage, and retinal detachment surgery. And retinal detachment was the most common indication for the third surgery. This table summarizes the outcomes in the study. We can see that the p-value comparing the mean initial visual acuity and final visual acuity was significant for all groups, namely the single surgery group and the multiple surgery group 2, and also the individual subgroups under group 2. This is a graphical representation showing there was greater visual improvement in group 2. So the final visual acuity was better for group 2, that is the multiple surgery group, than the single surgery group 1, although the difference was not statistically significant. And in group 2, although the p-value comparing the visual acuities at presentation, after the first surgery, and at final visit was significant, the largest effect size was seen when we compared the initial versus the final visual acuities. Similar studies done in the past include that of Sathers et al., who studied OGI cases undergoing primary repair with 2 additional surgeries. They noted greatest gains after the first and second surgery. Gomez et al. Had studied the ocular trauma score features in open globe injury cases, and they noted better improvement in visual acuity after standardization of anterior segment procedures. Studies have also noted better anatomical and functional outcomes after intervention of posterior segment pathologies in cases of open globe injuries. Hence, the popular belief that exists among surgeons and patients that vision may not improve after the first surgery, that is the primary repair, may not be so, as shown by our study. To conclude, the need for multiple surgeries in cases of open globe injuries and the knowledge of their outcomes must be borne in mind when explaining the course of the disease and prognosis to patients and their kin. Thank you.
Very good paper, doctor. And you had all adult patients in that?
Ma'am, the mean age was 24.06, so we included cases ranging from 10 years to 70 years.
Because nowadays pediatric ocular trauma society's trauma score is different. The founder of pediatric ocular trauma score is there.
Yes,
So
ma'am.
at least it's a total different. Nowadays toddler ocular trauma score also has come. So you don't know what the vision is if you are taking your patient below 10 years. So
Yes,
you
ma'am.
have to take
Yes, ma'am.
BOTS.
Yes, ma'am.
I think it's important for all of you to remember, and sir is here, he is retired as a chief of Army Hospital in Delhi. He was there for 14 years and he's seen numerous injuries. Basically, the globe injuries, what is important for you to remember is that as she presented, if required in 2 stages, should be done. Don't try to prove to yourself that I've done it in 1 stage. You need to prove to the patient. That is more important. There's a very debate going on all over the world on the forum is regarding the cataract. If you develop a traumatic cataract, people say, oh, you can do it in the first stage. Every case is different. It depends if you can manage to remove the cataract or probably just remove the fluffy matter lying in the anterior chamber and do it in the secondary stage after the inflammation settles down. So that is important that do it stage wise. But at the same time, you cannot wait for too long. Yes, majority of the cases will require multiple. And I think it's important for the posterior segment that you evaluate the posterior segment at a later stage because it's a open globe. Don't try to go for an ultrasound, especially the B scan or the UBM or any kind of intraocular foreign body if it's an open globe. Don't try to go for a CT scan or a MRI. More important is to repair the wound, try to maintain the anatomy of the globe. I'm just talking about the very basics. If you stick to the basics, you can do well. Regarding the orbit, of course, Dr. Akshay is a master of that. He can specify maybe later on or right now.
I just had a couple of questions regarding this. Uh, so the only thing that you all compared was the outcomes of single surgery versus multiple surgery.
Yes, sir.
Did the OTS, the ocular trauma score, have any effect on whether the patient needed a single surgery versus multiple surgery? Or
Sir, actually, we did not do
So
that as part of the study.
that is something that you can add, and because you have all the data, you can actually
Yes,
even
sir.
retrospectively tabulate the ocular trauma score and see if that correlates.
Yes, sir.
Because in open globe injuries now, that is the first thing, that OTS has already been validated to with the final vision.
Yes, sir.
So a poorer OTS or a low OTS has implications in terms of the final visual acuity and prognosis. So you could see if multiple surgeries changes that or not, or does the OTS initially still hold valid for the final visual outcome. Also, did duration from between the initial trauma to presentation have any effect on whether they needed single surgery or multiple surgeries?
Sir, though we did not include this, but it did not have a significant correlation.
Thanks.
Thank you, sir.